The way that I became interested in medical marijuana was watching people's clinical benefit to the use of this medicine. And then at that time, we started to try to gather information, appreciating what strains people were having access to and what strains of medicine in the plant were having what types of effects. So we wanted to, as clinicians, be able to gather that information to try to make sense of it, to try to figure out how can we streamline and aggregate all this information so that people get the best possible effect. Medical marijuana tends to be really useful because it addresses several different aspects of what a patient might be experiencing. So if a patient self-describes that anxiety or that there's an aspect of stress that is very primary or present to what's happening for them, in addition to, we talked a little bit about nausea, if nausea is a problem. What we're looking for, whatever the tool we're going to apply to the situation, is we always want to apply tools that are going to address the most significant impediments to their joy in life. We want to be as efficient as possible in providing medicine that is going to help people the most. The more medicines, one of the things we think of from all perspectives about providing people with treatment is that the more treatment someone is provided, the more information they have to make sense of. I referred to listening to 4 types of music at once. It's our brains have a really hard time making sense of listening to 4 different, trying to decode the sounds of 4 different types of music at the same time. It's not so completely different when we think about our body in a holistic perspective, that our body is going to offer the strongest possible response if we can give people the least amount of medicine. So we want to be as informed and smart and efficient as possible about giving people medicine that's going to help them in the widest possible way. And since we don't understand wholly what's happening when someone is using medical marijuana or cannabinoid, we look for what pieces they're presenting with most significantly and how we can, in order, address those top pieces and work down from there.